Good morning and welcome to Caregiving Cafe. Today we have Dura as a co-facilitator, Dura Sims, who has a wealth of resources and expertise in all things caregiving and hospice and senior living, and it's a long list. So I always appreciate to have Dura here via Paloma Hospice. And today we will have Belynda Montgomery, who will be speaking to us about patient advocacy. I hadn't really heard that term much, really, or at all a few months ago, but now it seems to be a thing. So as a family caregiver who is not trained and really doesn't know her way around, patient advocacy is a great resource for family caregivers, not just for the patient. So I'm so happy to have had the opportunity to meet you and that you are able to join us here today. So without further ado, I will just let you introduce yourself, Belynda, and tell us what you do, and then tell us all about patient advocacy and how can families and professionals really use your services to better serve our community.
Absolutely. Thank you so much, Len and Dura, for having me. I think that caregiving is the most challenging job. So kudos to you and the education that you provide every week with this group and other groups that you work with. And kudos to you for keeping it going. It is literally the hardest job because people don't talk about it. People don't provide resources. People don't care for each other. There's not a network like there is for parenting or other types of caregiving. So it is desperately hard, and my hat goes off to you and all of the caregivers. So to tell you a little bit about me, I am a patient advocate. I'm an independent patient advocate. So I work for myself. My background is I'm a physical therapist assistant and worked at a neuro rehab for 23 years and have had this business for 3 years. I onboard clients typically in wellness or in a period of transition when it's best not to necessarily transition or onboard people when they are hospitalized, just because there's so much transition going on there. So it's best to do it when there's a moment of calm, and I say calm, which, that has a lot of interpretations, but just not high medical need at the moment. It's and that may be just a stagnated period where the person presents consistently on a few days time versus they're in the hospital, they're having surgeries, they're moving from rehab to skilled nursing facilities to that kind of those transitions. Not critical, but it is nice to be able to onboard somebody when dumpsters aren't burning and hair's not on fire. I help people navigate healthcare in its most basic form and work hourly on a case-by-case basis, depending on what my clients need, to best meet their needs. So I have clients that live alone that need me to get them to appointments, to be part of the doctor's appointments with them. Sometimes I transcribe the appointment. Sometimes I just take notes and make sure that their goals and treatment needs are met when we're in the appointments. So sometimes that's in the form of a letter as I walk into the doctor. Sometimes that's reaching out to their treatment team beforehand. If it's a big diagnosis that we're going to get notice of, it varies depending on what it is, but we want to make sure that all of the information is conveyed, that all of the imaging and lab work and reports and consultations, have all been conveyed to whichever doctor we're meeting with ahead of time. So when we come in and we have that golden 15 minutes with the physician, that we can really best use that time to hear from them about next steps or about, just the information at hand, and not be scrambling for a piece of information that is key to that decision, but is not in hand. Because my background is in neuro, I have a tremendous amount of head injuries and stroke patients that I have had over the course of my business. And I'm here for them when they need me. They reach out when they have a transition in care, or they have a problem that comes up that they're whoever is working with them can't quite answer for them. And so we just work on a consultation basis at that point. You know, they call and say, like somebody this week, one of my first clients, her mom is having some menopausal changes and would like to do the deep dive into the menopausal hormone therapies. So got some information on that and circled back with them. I have several clients that are aging in place at home, and they're doing well. They live independently. They don't drive, but they have me manage their doctor's appointments and some of the other appointments that they need just to maintain life stuff, independent life stuff. So I work doing that for them. I'm happy to do grocery appointments. I'm happy to do, you know, all sorts of things that fall into the realm of you're a professional, you're in my home, you're caring for me, you know, cleaning hearing aids and, you know, whatever. It doesn't matter. Nothing is necessarily off the table. If it's something that I don't actually have a specialty or knowledge in, I am well versed and have a full breadth of contacts in this community. I was born and raised here. I'm a 7th generation Austinite, and especially south of the river, I know everyone. So it's easy for me to find people to best meet the need if it's something that I can't do personally. So we just onboard people. We hear what their individual need is. I work on an hourly basis after the assessment fee to meet the need over time. And it's not an everyday thing. It's not an every month thing. Once we've gotten the person stabilized and in a position where their needs are being met. But if the person is ill or if the person has other challenges, it may take a while to get to that point, and we just work through it however the client needs. Sometimes I'm hired by the client individually. Sometimes I'm hired by family here in town and I work with the family in town. Sometimes I'm hired by family out of state for families here. And one time I've been hired for an employer for an employee that needed an advocate. So I work in a lot of different realms and a lot of different ways, and I'm absolutely happy to be here and grateful to be able to do the work I do, and happy to take your questions about what you see as challenges where you could use an advocate in your individual lives for your individual clients or for your husband, Lynn.
Belynda, when you go into appointments with patients, how do you get around HIPAA since you're not family?
So we have, when I onboard patients, part of that first suite of documents we do is we sign medical power of attorney documents, not necessarily for me to be medical power of attorney, but for those to be signed, and release of information forms for me to have access.
And so then that gives you the ability to go into those meetings and sit there and ask the questions and talk on their behalf.
And HIPAA is not, if the person in presence has given authority for me to hear what is happening, I don't have to have it signed because they can give verbal authorization there. But if I am communicating with the medical team without that person present, then I need an ROI.
What if they have dementia?
Then they typically haven't hired me and the family member has hired me and they're in POA and they have condoned me to get an ROI signed.
Gotcha. Okay.
Now, occasionally we do get caregivers who do not have the medical power of attorney. And that is actually one of the challenges that many caregivers have faced in this group, anyway, that has been shared, is that the mother or the loved one just doesn't trust, or for whatever reason, just will not relinquish that power of attorney to anyone. So I know you mentioned a verbal authorization to speak to somebody else. What would be the thing to do then if it's not a signed document where the family caregiver is given permission?
So the primary care in that realm is the primary driver to help this. This comes up all of the time where people have not prepared ahead of time. People don't want to relinquish control, but they don't have the cognitive ability to be able to manage things for themselves ongoing. And so the primary care doctor, neurologist, whoever is the person that is primarily overseeing their care, can help have these conversations and help manage some of these documents, because they understand big picture. You know, the loved one goes into the hospital, they're unable to make decisions for themselves. You know, we have to have a designee, and sometimes on the forms in the hospital, you know, the next of kin, depending on what the doctor chooses, because there's a lot of leeway of doctor's ability to see people standing there, you know, in the patient's room, and see that they've been consistent and see that they care, and sometimes allow them some of that inside information and inside advocacy, even though there's not a document in place. But it's very site specific, and it's very specific to certain doctors who will have a little bit of leeway in that way, because they know that they can't, the person that is the client, is the patient at the time, needs the ability to be able to be sick, you know, and somebody else needs to be advocating during that time. But it is a very slippery slope. It is very tricky, and it's best to have documents in place. So we work towards that, and that is the goal. And that is one of the things I lay out when I first meet with people. And I have an attorney that I work with who's amazing. One of my dearest friends is his admin. And so we get a suite of documents done, medical power of attorney, durable power of attorney, the HIPAA document in lieu of the HIPAA document, then the I can't remember the phrase, but it's like upon death, everything transfers as far as like formal accounts and things, and then the will, of course. And that is the estate documents that we work to get towards when I first start working with people, because it's too challenging to be in an ER. You know, the person is not able to make decisions for themselves. Things are going badly, and decisions need to be made, and we don't have the documentation done. Then I don't have a right to be there, and their wishes are not being cared for and carried through. So, or even known, because maybe they haven't even had the opportunity to express their wishes. So
yeah, it's definitely a challenge. We always encourage people, you know, to learn, you know, education is power, and to do things early when you're still able, you know. So hello, Darlene. Nice to see you. Thank you for joining us today. So so anyway, that is a really important role. And one of the things, I haven't had much experience with hospitals, and when I did, that was several years ago with my parents. But I know Dura comes across it, and perhaps Darlene, hi, can you hear us all right?
Yes.
Okay, great. So Belynda, in the it looks black from here outfit, is our patient advocate who's speaking today. And I was wondering if you might have some questions or situations where you could have used a little bit more knowledge about anything related to caregiving, and or wish you had known the ropes kind of thing, because that is what she does. You know, she has the inside scoop.
Yeah. That's kind of funny, because I'm a retired nurse, and I used to work as a social worker, and in the hospital, nurse/social worker type person, discharge planner. And then I also used to work as a patient advocate in the business office as an audit nurse.
nice.
Yeah, I've been down this path with patients, several patients, just, you know, trying to be their advocate. I was in California when I got started doing this, and there were so many elderly people in California whose children lived in another state. It was just like crazy. And so we had all these elderly patients in the hospital whose kids were all over the country, you know, And so that was always a challenge to
Challenge. It
work
is
with them.
the hardest thing ever. I worked in case management for a year or so at my hospital at Texas Neuro, where I worked for 23 years. And that was our biggest challenge is somebody is unable to speak for themselves, has had a terrible accident. Everybody lives out of state. And it's who's on first, what's on second. You get somebody on the phone, but that's not a person who's willing to take responsibility or even work with you long term. And then you might get somebody on the phone who's absolutely willing to work with you. And that's not who the client wishes to speak for them. So it's this.
Yeah, it's really tricky. It's very tricky working through all those things. And
Yeah.
this was many, many, many years ago when we didn't have, this was way before HIPAA. So this was when we didn't have all the rules and regulations that we have now. And I mean, I just see so many people that I have two friends right now whose parents are in their 90s
Wow.
and who are in like nursing homes, assisted living things, and they're getting calls all the time for, oh, she fell, oh, she did this, oh, he did this, oh. And it's so disheartening because they won't put him on hospice, but they don't want him to go to the hospital all the time. And nursing homes send everybody to the hospital. I
Right.
mean, they don't have a choice, really. So,
Right.
my husband started in Dallas, started one of the first hospice programs in a nursing home in Plano, Texas in
Wow.
1981.
Wow.
He was in private practice, and there was a really sharp nursing director at this nursing home that he had a couple patients at, and they would talk all the time. And finally, the two of them got this idea that they could stop sending people across the street to the emergency room all the time if they would put them on this hospice program. And
Yes.
so they did, and it just changed the whole way the nursing home
Way
operated.
ahead of their time. Way ahead of their time. Yeah, that's
Way ahead of their time, yeah. But it was really, and so many people were grateful for that they just didn't have their loved ones dying in the ER and an ICU
yes.
when they could have just had a peaceful death in the nursing home across the street.
Yes.
Yeah,
Without
we don't
understanding.
have this right yet. We're still working on it,
Yeah.
but yeah, at this point, I really don't have any questions with regard to, for myself, with my husband, things are going pretty well. As,
Great.
as the hospice people are doing what I expect them to do. And so, yeah, it's going well. I mean, Steve's just kind of real status quo right now. He's not really changing one way or the other. So it's kind of difficult to just be in that kind of, I feel I'm in a limbo state a little bit. I go to another support group that's really good, and we had a meeting the other day about who are you putting your life on hold for, or what are you putting your life on hold for? And it was a very interesting meeting. And, I'm a pretty active person. I haven't had my life on hold for much. So this is a bit of a challenge for me. So I'm trying to be patient, and in a lot of ways, I'm glad it's happening in the summertime because I need to stay indoors anyway.
Right.
Yes.
If you're
Love it.
people in general, you might as well be in air conditioning. Yeah.
Yeah, right. Except this is the first time in 21 years that I've spent the summer in Texas. So I usually go someplace during the summer. I usually don't spend the summer in Texas. So that's a challenge too, to just be here.
It
So,
is.
yeah.
Yeah.
Darlene, do you mind if I ask, is your husband at home with you?
Yes. Mhm.
I'm glad. I'm glad. That's wonderful that he can be there with you and that
Yeah.
it's working out.
Yeah, and it's working out pretty well right now. I probably need to find more help to come in, but the thing about that is to have help come in right now, I don't really want to go out, because it's too hot to be out unless they want to come at 5 a.m.
Yeah.
You know,
Yeah.
most of them don't. So
Spring. Yeah. It's we're all topsy-turvy right now with weather and schedules and
Yeah.
in all the ways, whether you're caring for somebody at home or not.
Yeah.
Yeah.
Yeah. I think one of the biggest things, I mean, you have a different perspective because you're more dealing right with the patients or whatever in their care, but I think I just had when I worked as an audit nurse, oh my gosh, I just had so many patients that would just be overwhelmed with their hospital bills.
Oh yeah.
And, with all their, like 10 doctors, you go to the emergency room and you
Mhm.
get admitted to ICU, and the next thing you know, you're having bills from 10 different physicians, most of them that you don't ever remember seeing, or
Right.
the family doesn't ever remember seeing them. And the stress of that was really difficult for family members.
Absolutely. And yeah, somebody may have reviewed your chart or seen you in pre-op when you were unconscious and billed you for something, and you're like, I never saw you. I don't know who you are. Why did you send me a bill for $1,000 or more?
Yeah. Yeah.
Um,
So
Actually, that's a great point. So I always forget about the financial side of medicine. But what would you recommend? Because I've also heard, and I've gotten some ginormous bills myself. What can a patient or a patient advocate do to deal with those ginormous bills?
So there are patient advocates that specifically help work with billing. That is not my purview necessarily. I'm happy to guide and support people through that process, but it's not my wheelhouse. But I do know there are people that can help you with that. But the main thing you want to do is request your actual bills. Always get your actual bills before you leave the hospital or as soon after you leave the hospital as you can, so you can actually physically review them and look at them for duplications or medications that you didn't have, or whatever. There's always going to be things on there that are mistakes in different ways, especially if you were there for a while, especially if you had a surgery. They're very long and lengthy. So always request that so you can look at it and just see off the top if there are duplications and that the dates are correct, and that your care makes sense in that way. If it doesn't make sense in that way, hospitals actually have patient advocates that are part of their hospital, and you can reach out to them and try to work with them if there are complications or questions that you have about your bill in that way. Additionally, there is a nonprofit called Dollar4, DOLLARFOR.org. And they specifically help people with hospital bills get connected to charity care that hospitals already have, that a lot of people don't know about. So you can go on their website, enter where you are hospitalized, the dates, some very basic information, and they will tell you if your bills at that hospital are eligible for application for their funds. And they have given away, I don't even know how many millions of dollars connecting people with the charity care that's already established. People that have had big hospital bills just don't realize that these charity care offerings even exist. So this organization, that's specifically what they do, is just connect that money to the people that have the bills. So that's a good way to start also, and especially if you don't if you have large bills that you want to start with those, help you with the process of working through it.
Okay, thank you. I had never heard of that.
Yeah, that was wonderful.
Yeah, because especially when you have, like, there was this caregiver there's a lot of congestive heart failure out there and heart surgery. So
yeah.
They have come through Caregiving Cafe, and some of those bills were like hundreds of thousands of dollars. And that was just one of the bills. So yeah, that was like really rough. So that's really great.
One day of the bills. So then they, anesthesiologist comes in and Neurologist comes in, they all bill separately,
So,
so.
if someone is in the hospital, a loved one's in the hospital, what kinds of service? Because see, I had no idea. I've had, family members in the hospital. I had no idea what to even ask, what they offer. So now that I do, it might be a good idea then whom would you ask? I guess maybe the nurse to say, tell me who can be a patient advocate or a social worker, or who can work with me. I know when my dad was in the hospital, heart surgery, and that was that was before, but 19 years later, he had cancer, and I'm serious. Nobody even offered my mother a glass of water. And there she was, and I thought, oh my goodness, there has to be, which is one of the reasons that motivated me to start Caregiving Cafe, because I saw how alone she was. Even though there are all these people out there. Well, isn't there somebody who will help family members when you're in a hospital setting that can, to advocate for the patient is everything, how are you managing the situation for the families, helping them informed about what services might be available, or even, I don't know, support, emotional support, or a sitter.
Yeah.
Well, do hospitals have social workers now that see patients?
They do. But of course, as you know, they're assigned way more cases than they have ability to care for. But in general, depends on where you are in what hospital setting. If you, like, for instance, I have a client right now at University of Texas Medical Center. He was burned in his backyard trying to burn some brush and had an accident and burned himself, unfortunately. He's been there 21 days. His daughter is staying with him exclusively, and except the one time she went out of town for a couple of days and grandchildren stayed. But she has befriended all of the medical staff that come in, but the medical assistants, the techs that are on the floors, they're there every shift. They're typically there the 12 hours that the nurses are there, and they are your relatable people who are not charged for productivity in their time and engagement with clients, so they can really spend more time with people if they're not, overwhelmed with their responsibilities. 9 to 5 shifts, Monday through Friday, and sometimes on the weekend, depending on the setting that you're in. There is a social worker like Darlene or a case manager that's working with you in a more empathetic and compassionate, relatable way to try to support you the best they can. Of course, there's always the chaplains, who are a wonderful team of people that are totally non-denominational if that's the need, or can come in specifically if not, and be there to support you. And you can request that they come as often as you need. If you need a daily connection, if you need daily restoration, that is a way that you can get that connection. They also, a lot of hospitals have a little bit of a chapel space or a sacred space in the building that you can go and seek care and support there also. Welcome, iPhone 2. I can't tell who you are.
I saw. I was waiting for a name or something to appear, but yes, hello, welcome. So thank you, Belynda. So
Sure.
hopefully we'll be able to see you and hear. So so that's really great, but I guess it falls on the family to ask for these things, because and I do understand they're busy, but the family needs support.
Absolutely.
Right?
And just the lay of the land in a hospital, very little is going to be offered to you beyond, the responsibility of your basic needs if you don't ask.
Right. So
in hospitals across the whole.
First, right? Yeah. So, okay. So again, education is power.
Absolutely. Education is power. I've been across the hall from clients advocating for them when they had, really challenging hospitalizations, and been with them all hours, spent the night, been with family. There have been patients in rooms across the hall. Nobody ever came in other than a medical staff person. Nobody was there with them at night. Nobody visited. There was not a card, there was not a flower, there was not a balloon in the room. Very few people have people to support them when they're in a hospitalization stay, and that's a real challenge. I'm not here to make excuses for medical staff or the situation of COVID that really just highlighted a system that already wasn't supporting its staff or their patients. But now it's even a little more challenging at times. There are a lot of shortages in places, and holding people accountable for that is important. But also just generally understanding that the staff in a building are, you mentioned earlier, Lynn, a nurse that was not kind. I know that nurses at times cannot be kind. I know that there are lots of staff that, cannot be kind at times. But the environment that they're put in and the stress that they're put under is copious, and that, again, that's not an excuse. I try to find grace before I bring out the dragons to slay people, because it's you don't know what happened in the next room. You don't know what happened to them at home. There may have been something unrelated to their job that they're dealing with, and they are people first, and they're trying to desperately care for their people. But we all have challenges.
No, I believe it or not, I'm very compassionate, but I do remember this one nurse. My dad was in so much pain. She said, "Oh, it was time for him to eat." So she brought the hospital bed from lying down to whoop too quickly.
Yeah.
And he just so painful.
Yeah.
And she should have known better. And the other time she was rushing him to dialysis, and the bed has little metal wheels.
Yep.
Fractures on his back. And she was just, and my sister and I said, slow down, because you could see that my dad was grimacing in pain. Like, yeah, you need to slow down. This is a person too. So I do get it. And thank God it didn't happen very often. But, so anyway.
And that's a to myself too. I as a therapist, I had productivity and clients I was trying to get to quickly, working in the hospital, and I was rush too. And I needed situations like that to be reminded that, you rushing is detrimental to the care of your people. It has the opposite effect of what you want. So just slow.
And for us family caregivers who are at home or anywhere, it also applies there.
Absolutely.
I've also done that. So but anyway, yeah, just a thing. So does anybody have any comments or questions? Because I always do. So all right, so let's talk about advocacy in a senior living setting. How can
back up, just speak to that specific case. In general, I'm sorry.
No, I couldn't hear you for a minute, so I can hear you now. Yeah.
Perfect. So in general, there sometimes is the school of thought that patient advocates are working against the system to get care for their clients. And that is not the way this works. I'm part of a team, and we are a team approach to provide the best care for the clients. So I'm not against, I'm not challenging things unless the situation comes up that needs to happen. But under normal circumstances, I come in, I enmesh myself in the knowledge of the client, and then work together with the team to provide the best care over time for that person. So whether I'm in a skilled nursing facility or a rehab or an ER, I am fully knowledgeable about the person up until that point. So history and physical, consultations, appointments that they've had, stuff that happened in childhood, if there was, issues with whatever, they fell and broke their arm 3 times on one side, whatever. I know all of that stuff. So I'm just kind of the historian in the corner of the room that can speak to things if the client's not able to speak to them for themselves. In a skilled nursing facility, I lay a lot of expectations out to remind the staff and the client what the responsibilities are of everybody in that facility. A skilled nursing facility is a step down from rehab, but there are still expectations that the person will participate in activities, will participate in therapies, will try to get up for meals, will try to be up when family visits. There's responsibility on both sides. Therefore, the staff need to be able to facilitate that person being able to get up and be ready for those activities. So it's hand in hand. It's a lot of communication with the case manager or social worker within the facility to help manage appointments. If there are appointments outside of the facility that need to be managed, follow up with labs and other things that might need to be managed. And then hopefully the person gets to a place where they have stabilized and maybe they can go home, or maybe they can go to a rehab facility, or if not, and we go the other way, maybe transitioning to hospice and maybe doing it in the skilled nursing facility, as Darlene mentioned before. So important to think ahead of the process of the person and what they might need, and see if they can, if the environment is supporting them in that space, see what can be brought into that space rather than move the client from place to place to place to have their needs met. It's just so nice to flip it on its ear and do it the other way around, and have hospice come in, or have additional sitters come in, or have additional therapies come in to where they already are, rather than trying to transition to a new facility or a different place that you think might meet their need better.
Yeah.
Belynda, are you making those recommendations when you
Absolutely.
see somebody who is appropriate for hospice, and how are you identifying that? And then how are you attacking that conversation with the families and the facilities?
I'm sorry, Jerry, you broke up a little bit.
Sorry. How are you having that conversation with the families and the facilities, and how are you applying, looking to see, is this the right next step, recommending hospice?
So I ask that I am invited to the team meetings whenever that is. Sometimes it's monthly, sometimes it's weekly, depending on the stage of care and the status of the person. So I ask to be a part of that team meeting so we can identify what the best next step is immediately, and then identifying the 3 steps down the road. And so we're prepared, and we've had those conversations, and everybody's on board to that plan. So nobody's surprised. We're managing the expectations way ahead of time. If those recommendations need to be made for specific agencies to come in and provide services, I can help with those recommendations. If there are people that are already in-house that they work with, that the clients want to chat with to make a decision, I mean, we can provide lots of options if they would like to shop options, or if they just want to go with who's provided, we can work with their comfort level. Sometimes time is of the essence, and the people that are already in-house and established makes the most sense, because you don't want to have to wait 24 hours for somebody to be able to onboard for different services. But it just depends. Every case by case is different. But I am nimble in my ability to work with however we need to do it for the client. For them, it's best.
Mm-hmm. Mm-hmm.
What areas do you work in?
I kind of go everywhere. Mostly Austin. I have gone out of the scope of Austin proper. I do a lot of engagement in Georgetown, and that's totally fine. I don't have a problem with that. I have gone further than that in emergency cases where places were just not offering good care in general when things were bad and they weren't getting better, and there were no other resources for patient advocates. But I really try to work with greaternationaladvocates.org is a great resource to try to find somebody closer in the area where you need care. I have friends that hire me for their family members to go when they are having a knee replacement or hip replacement, and go modify the home. So it's best for them when they come back from surgery, you know, getting the bathroom with all the tub benches and safety arms, and maybe clearing out some furniture so a bed can be easily accessible from a wheelchair, bedside commodes, all that kind of stuff. Hoyer stuff, if we need to get a Hoyer into a space. And as a physical therapist assistant, I trained people all the time. So sometimes people need a refresh on that. And I work with staff to be able to facilitate all of that also.
What is your website? Do you have a web address?
BBMadvocate.com. And BBM is my initials, Belynda Barkley Montgomery.
Advocate.com.
And I
What's your
included the email, FYI.
Is it in the email?
But that's
Okay.
okay. Did you
Is your email in there as well, Belynda?
I'm not looking at the email at the moment, but my email.
Oh, yeah, I'm sorry. The email says CC. It always CC's a speaker. So everybody can see the email address. But it's Belynda@bbmadvocate.com.
Yes, perfect.
Her phone number is
Can you put your contact information in the chat, Belynda? Your phone number and contact information?
Happy to do that.
a lot.
I'm gonna put my information in the chat as well.
I don't know what's going on with the chat at the moment.
Oh, the chat's not accessible?
My whole screen just went white.
Okay, so can I dictate it? I can put it in here. It'll just take me longer. Okay, I'll put in
What's
512. If I can see 736 9333. Okay. These glasses, I can only see through this little area down there. So it's like, okay, I need new glasses. So
I put my information in there as well, Belynda, because I would like to talk to you further about, you know, our hospice services as well.
okay. And do you,
melting down.
okay.
Oh, there we are. Hi.
Okay. Belynda, do you are you or do you meet on Zoom or go to meet or whatever online if you need to? Just
Absolutely. I need to assess people initially in person. I don't know how anybody can ever do that otherwise. So I try to meet in person, them coming to me coming to them, or meeting in a hospital or clinic, however we need to do that initially. But yes, beyond that, Zoom is totally fine. Phone calls are totally fine. But if it's something that needs to be reassessed, or something has happened and the client is presenting differently, I would love to be able to see what that is like with my own eyes. So I'm happy to come to people.
All right, thank you for that.
How are you hired? Is it like some families will call you and say, we just need you to go to a doctor's appointment, or is it like, we want you to be with our parent all the way through to end of life type thing?
It's both. It's absolutely both. Often when I am hired for one appointment or one transport to one thing, it morphs into more things because they just realize that they would like to have a medical professional with their person for more time and more opportunities. But I'm happy to do smaller things for people who are not, tremendously sick in a process, so if we're not managing a lot of just illness during that time. like if they're aging in place and they just literally need a transfer to their doctor's appointment, somebody sit in the doctor's appointment with them and then drive them back home. That's not a problem at all. If somebody's, you know, in the thick of cancer care and doing infusions and that kind of thing, and they might need transportation, I'm happy to do that. It's just sometimes the folks are so complex that we need to do a full onboard to be able to best advocate them over all of their needs, even though they're only hiring me for something, you know, specific. But it's totally on a case-by-case basis. I have not yet had somebody that hired me for a small thing, and it was more complex than it needed to be. Yet, of course, I've only been in this business 3 years, so you know, tomorrow may be a different situation. But today, as of today, it seems to be easily managed. Let's say that.
So you're actually picking up the patient, putting them in your vehicle, transporting them to and from the appointments, staying there with them, and then taking them back home and kind of debriefing in that moment? Or is it meeting them there? Is it case dependent on everybody?
It's case by case. If they are really a challenging transfer, or it's something that my vehicle cannot support, I work with Elder Wheels. She's a physical therapist assistant and has a fleet of vehicles and can help get people transported. All of her other drivers are therapists also. And so they are not only incredible, empathetic, and kind people, but they are deeply skilled in the facilitation of moving people in wheelchairs and otherwise. So if it's out of my scope or I need a second pair of hands, I reach out to Elder Wheels.
Wow.
Are they located only in the Austin area, or are they in the surrounding?
In Austin. Yeah, they're in
Only
Austin.
Austin.
Specifically.
Austin got all the good stuff. It doesn't seem like anywhere else has all the extra additional support kind of that you can.
What are you in Texas? Where are you?
Yeah, so I work in Hayes County, I work in Travis County, I work in Bexar County, Comal County.
Elder Wheels will go anywhere. They're just stationed here. She lives in Manor. She'll travel anywhere. She's taking clients of mine from the hospital. Or actually, they were patients of mine when I worked at the hospital. 2.5 hours home before for
so even those rural areas, she'll go out to the rural areas.
Oh yes, heavily, yes, not a problem. But they also will do medical transport to doctor's appointments, similar to what I will do for somebody who just needs somebody to get them consistently to an appointment and be in the appointment and help get the person back home. So we both provide that service, but they don't necessarily do it over the course of time, you know, but they can do it. They can pop in and do it individually.
Wow. That's amazing.
It is amazing. They're amazing. Oh, one more thing about them. Elder Wheels just opened a respite called, I'm going to mess up the name. I can't remember what the name of the respite is, but it's an up to 2-week stay with very close to one-on-one care. It might be 1 to 2 or 1 to 3 care with caregiver and client, but they do activities. Of course, meals are included. All of the very personalized care to provide families the opportunity to be able to travel or go to a funeral or, you know, whatever other things, go be with grandchildren, you know, for a period of time. And that's located in Manor, Texas also.
That's from Elder Wheels? You said Elder Wheels is?
Elder Wheels offers that, and I can't remember the name of their respite, but they are the ones that do it. And
like overnight respite or day respite?
Overnight for 2 weeks, up to 2 weeks.
Oh my gosh,
really?
that's
So
amazing.
they have a building? They actually.
Yep.
Oh, wow. Okay. Interesting. And it's solely respite?
Yep.
Oh, I need to go see this place. Do you have any idea? So it's in Manor. How do you get a hold of them?
Let me give me 2 seconds to Google. I apologize for not having that information on the top of my tongue. Let me just give you Elsa's phone number. Let's start with that. Elsa is wonderful. Her phone number is 512-779-8383. And let me Google her.
Is
It's
she
got
the
a
owner?
cute name. I'm sorry?
Is she the owner? Is Elsa the owner of the
Yes, she
respite
is.
or elder? Okay.
She is the owner.
779-8383. Okay. And this is in Manor.
Yep. It is called Kith and Kin Elder House. Kith is KITH and Kin Elder House. And it's
and
open since April. Uh-huh.
and Ken.
KITH and KIN Elder House.
Oh,
How's that paid for? Is that covered through Medicare? Is that out of pocket? How is, what
it's out
did
of
you,
pocket.
you know,
I think
out
it's
of
out of
pocket only?
I don't know. Let me look at the website. Hold on a second. Sorry, I should have this up for you guys.
no, that's fine. Thank you. We appreciate it. And did you say it's out of pocket? Because
I think so.
up a little bit. So, okay. But this is wonderful because, I mean, as opposed to not having an option,
Right.
we can always set up a GoFundMe account and raise funds. Wouldn't that be wonderful? But also,
Hey, everybody's setting up a GoFundMe account for their dog. Maybe we should start setting
yeah,
up a
I mean,
GoFundMe
seriously,
account for
yeah,
for
uh,
our family members.
I know that my husband keeps telling me because his meds are just exorbitant sometimes, but the Alzheimer's Association will pay for up to, it used to be and probably still is, $250 towards respite, whatever that means, whether it's home care or
Nice.
a place. So will the Area Agency on Aging cover respite. Now, I think they would pay for home care, but I'm not too sure about a place. And there's also lifespan respite that it's a separate fund through Area Agency on Aging. So they have two ways of covering respite, and that may include, I can't promise that it includes a facility, but certainly is so that caregivers can get some respite.
That's great. I am not searching very well on my phone for that, but the main number or elderwheels.care is the website.
Okay, thank you for that. I can look into it and then I will email what I find
Great.
within the next week, okay?
And also would be a great presenter for one of your caregiver cafes. I know that she would absolutely be open to it.
That would be wonderful. Elsa, you said, okay. What is your last name?
It is unique.
Okay,
And so I never remember it.
so that's okay.
And let's see. I think it's B-O-U. No, B-U-I, excuse me.
B-U-I. Is that it?
Yep.
Oh, okay.
That's why I never remember it, because it's very simple.
Yeah, okay. So I can't pronounce it, but
I try to make things more complicated.
okay, well, thank you so much. This has been great. Okay, any questions, comments from anybody? Wow, we're finding out lots of great stuff. Thank you so much.
This is funny. I just looked up their the website and it says a designated driver is required by the medical provider for post anesthesia safety. We hang out at Austin Gastroenterology relatively frequently. Doing colonoscopy to and from.
Yeah. Because they won't let you use Uber or Lyft for colonoscopies anymore.
Oh, right. Okay.
Oh, I didn't know that.
No, neither will dentist or any time you have to go under any type of sedation, you can't do Uber or Lyft.
Yeah. Yeah. Well, I mean, which in general, I appreciate that they're not putting people who are, not in full cognitive form in a stranger's car, but it does make it a little more challenging.
Yeah.
I just had to cancel a root canal because I didn't have a way to get there.
Oh, Dura, I would take you.
Oh, you're so sweet. That is just music to our ears, Belinda. Thank you. I'm so glad that we crossed paths.
Oh, absolutely. I'm so glad we crossed paths. The world has a ton of need. And if I can
Yeah.
simply take somebody to a root canal so they can get out of pain,
Mhm.
like the backside will come back to me. I'm not worried about,
And you know what else? I have, because I was trying to look for a physician who would make house calls.
yes.
If we go to senior living communities, not to private homes, most of them. And so I live, in a nutshell, too far away from
Right.
that. You're too far. You're too far. And I thought, I live where I need to live.
Right.
Too far. And I thought, and I'm sorry, but not sorry. I don't have the patience. You do a kindness. And yes, it's farther away. I get it. It costs gas. But if you saw my husband,
Yeah.
Yeah.
anybody with any kind of a heart would
Yeah.
say, let me help you.
Yeah.
And that was, no, you're too far away. I don't go that far. And that's
Yeah.
what I kept hearing, and it just
People.
really,
These are people that are struggling, that need help.
yeah. And I kept thinking, you're in the wrong profession.
Yes.
It's
Yeah.
not helping people. I
Yeah.
would drive the extra mile, so I've done that.
Yes.
Yeah.
So anyway, so Dura, you also let me know next time.
Oh my gosh.
You know, I you know how when you're used to being the one who's doing the caregiving and offering others, you don't think that people will actually be there when it's time for you. And I found out later after I canceled, my boss is absolutely a lovely human being. And she goes, why did you cancel? Why didn't you just call me? I was like, she goes, call them right now. But by the time I called, they had already filled somebody in my spot. So, but yeah, I have to remember that there are a lot of people out there who would do things just because they care.
Yeah. I bet my dentist would bring you home. I'm so in love with my dentist. I bet they would.
Oh, well, maybe there's an opportunity for extracurricular activities there. Who knows?
Parking lot about 10 years ago, and he helped me jump it. And since then, I don't even know how much business I brought to him, but it's not because I'm trying to repay. They are wonderful, wonderful people that are just so empathetic that all my clients go to them because they're just great. They're not car salesmen at all,
Yeah.
dentists are, and they're not. They're just, a medical provider. They're not trying to, upsell you on things.
Right, exactly.
Yeah, cool.
All right. So, well, any
So
other?
I need to get off the call because guess what? I'm having guests at my house today. I'm so excited that somebody's coming to visit me other than medical people.
Oh, that is
So-
so wonderful, Darlene. I'm so proud of you. So I hope you have a wonderful, wonderful time. And thank you
Yeah.
for making time to join us today.
Yeah, I'm glad I remembered. That's always my problem here is remembering. But anyway, I finally did. So yeah, and thank you, Belinda. This was been really good. I have a few notes and yeah, this is all these things we need. So thank you.
Thank
So I'll
you.
see you in a couple of weeks.
All
Take
right.
care.
Bye.
Take
See
care.
y'all
Bye-bye.
soon. And I guess while I have you on, but you know what? I guess we should acknowledge iPhone 2.
Yes.
I think we
did,
tried
but
earlier. I'm not sure if they can hear us.
okay, yeah, because it's off and I'm sorry, but I don't. Can you unmute so we can welcome you properly? Okay, it's still muted. Okay, well, I'm going to end the recording and I'm going to say thank you so much. It is still muted. So iPhone 2, we'd love to chat with you, but I'm going to stop the recording in case there's anything else that needs to be discussed privately. Okay, let me just figure out how to do this. Thank you so much, Belinda. Okay, there we go.
And Belinda, I